Hello, dear friends. I am Dr. Azarwani. Let's learn more about genital herpes. Genital herpes is a common sexually transmitted disease throughout the world. It causes lesions, blisters, itching, and irritation in the genitals, and there is no cure, which increases people's concern about the spread of this virus. However, there are some measures that can be adopted to reduce the risk of contracting the virus if your partner has the disease. However, be aware that there is no foolproof way to avoid contamination when having sexual intercourse with an infected individual. Using safe sex practices. 1. Recognize the symptoms of a herpes outbreak. When an individual has genital herpes, the chance of them infecting their partner during sexual intercourse will always exist. However, the risk increases when he is suffering from a herpes outbreak. Therefore, it is essential that both people know how to recognize moments when the symptoms of the disease are attacking. Let's discover some of these symptoms. A tingling sensation in the infected region, a small red dots or blisters around the genitals, flu-like symptoms such as headaches, muscle aches throughout the body, fever, and swollen glands. To support my channel, please subscribe, like the video, and write your opinions. Thank you. Number 2, the ideal is to avoid having sexual intercourse during an outbreak. Most likely, the person with herpes will infect their partner by having sex during a herpes outbreak. To avoid being infected, talk to him and tell him that the best thing to do is to avoid having sexual intercourse during the increase in symptoms. The duration of symptoms will depend on how long the person has had the virus and whether they consume antiviral medications. On average, outbreaks last 3 to 14 days. Number 3, use condoms or latex mouth guards. The use of condoms or dental dams, a type of protector that is placed in the mouth to prevent the transmission of viruses during oral sex. This reduces the chance of contamination by genital herpes. This is the dental dam. Remember that this disease can affect part of the body that are not protected by dental dams or condoms. Therefore, such protection methods do not eliminate 100% of the risk of transmission. The use of latex condoms greatly reduces the chance of transmission of genital herpes, which is reduced by 30 to 50% when used correctly. Dental dams may not provide as much protection as condoms, but they are helpful in preventing the spread of herpes. Herpes can be spread through oral sex, regardless of whether the person is giving or receiving oral sex. They can be infected by a partner with the disease, making it essential to use condoms or latex protectors in this type of sexual contact. Take the use of lubricants into consideration. Although they do not protect against STDs, they reduce friction and limit the number of outbreaks, in addition to preventing condoms from breaking during sexual intercourse. Number 4, do not touch the lesions caused by herpes. The disease can also be spread through skin contact. Avoid touching bruised areas when sexually stimulating your partner, especially if they are experiencing an outbreak. When touching herpes lesions, wash your hands immediately using soap and hot water to avoid transmitting the virus. 5. Be open to different types of sexual activities. It is normal for an individual to be uncomfortable having conventional sex if their partner has genital herpes. The good news is that there are many other ways to have a pleasurable sex life even if you don't practice certain intimate activities. Mutual masturbation does not pose a risk of transmission, while genital stimulation through your hands can also be a good option as long as you wash them well after contact. Try these alternative sexual practices and be creative, finding an activity that both partners enjoy. If you share sex toys, wash them carefully or change condoms after use. Doing so prevents the virus from being spread. Let's learn how to communicate with your partner. 1. Ask the partner with herpes to make an appointment with a doctor. Advising you to go to the doctor so that the disease does not spread is a great decision, as the professional will be able to recommend treatment options that reduce the chance of the outbreak spreading. Be respectful when suggesting that your partner see a doctor. Talking about herpes can be stressful and embarrassing. However, the suggestion to consult a doctor is for the person's own health. Explain to your partner that your intention is to provide a good sex life for both of you. Say that the doctor can prescribe medications and other treatment options that can reduce the chance of transmitting the virus. Say something like this: I like you and I really want to have sex, but I need to make sure that both of our health is not harmed. How about talking to a doctor to find out the best way to have fun safely? 2. Ask the partner with herpes to take medication. Antiviral medicines can be used to combat a herpes infection. If used correctly, they reduce the risk of transmission. Your doctor may prescribe antiviral pills. Some people take such medication every day. However, the professional may recommend taking medication only when the individual experiences an outbreak of herpes symptoms, especially if they are rare. Medication is not the best form of treatment for everyone with herpes. Only a specialized doctor can determine whether taking antiviral medications is the most appropriate course of action. 3. Have a frank conversation with your partner. If he has genital herpes, talking about his sexual life is essential, establishing limits so that you don't become infected. During this conversation, stay calm and keep everything in perspective. Remember that herpes poses few health risks other than skin irritation, and that many couples have sex for years without spreading the virus. Express all your concerns. To prevent the spread of herpes, you may prefer to have sex only with condoms or avoid intercourse during outbreaks. If the relationship is serious, the concern about spreading the virus may also be less. Number 4, help him find support groups for people infected with herpes. Having this virus causes the individual to suffer various types of prejudice from society as a whole, and support groups can be good places for them to be able to talk about everything they need to about the disease. Help your partner find support groups online or in the area where they live. Number 5, get tested regularly. Whenever possible, couples where one person has herpes or similar infectious diseases should be tested for STDs. Make an agreement with your partner and decide that the test should be done once every 3 months, for example. Thanks for watching. Please let me know if you have any other question.